Hey, what's going on, everybody? I have COVID. So I wanted to talk a little bit about COVID-19 testing and also treatment and recovery, specifically how long you need to isolate for, whether you need to isolate at all, and what kind of precautions you need to take. For me, this affects whether or not I can make a penny. I mean, I can't see patients unless I'm 110% sure that I'm not going to be transmitting the virus. And I also, because I have been hired as an EMS trainee by the Fire Department of New York, I also can't go to the training academy. I can't even go into the headquarters to do paperwork right now because I've had a positive COVID test, so I have to stay out. And anyway, I wouldn't want to because I don't want to expose people. I don't want to get other people sick. I don't want to be responsible for that. I do feel very strongly, clearly, that it's my responsibility to protect other people from whatever risks I'm bringing out there. So I wanted to share with you guys I wanted to share with you guys some of the guidance, information and guidance on COVID as of September 25th, 2024, because I need refreshing because I need to refresh this information for myself regularly. I don't remember this stuff and I don't have it in the forefront of my mind all the time, so I had to look it up. And in looking it up, I found, it can be pretty confusing because there's multiple websites out there that you can consult, and most of them have information that concurs, that comes from the CDC, but some of them have some slight differences in testing. For example, whether you can get a free test, what kind of test you can get that's free, can you order tests from the government? Okay, so if you just go to a search engine and you type in New York COVID or COVID NYC or something like that, one of the results that comes up will be from the New York State government website. So two different things to take a look at. First, get tested. Testing gives you information, and information is power. It determines or helps you to determine or decide whether you should go to work, whether you should go in for your administrative day with your new job. Should you be around pregnant people, children, older people? Should you get on the subway? These are decisions that weigh pretty heavily on me. So these are things that I really want to have clear, and I think some of you will feel this way too. Okay, if you have symptoms of COVID-19, test immediately. That means go to CVS, Walgreens, Duane Reade, whatever, and get yourself a rapid antigen test, and take one of those. Or if there's a location nearby where you can go get a PCR test, which may take 1, 2, or 3 business days for your return results, go get it that way. That might be at your primary care physician's office or a local hospital. If you have health insurance, it'll take care of the test. Unless you have Medicaid, in which case it's much more strict. You have to go to your PCP. I have Medicaid, and it's almost better if you don't have health insurance, because there are plenty of sites, at least in New York City, where the city will pay for your testing if you're uninsured, but they won't pay for it if you have Medicaid. You have to go to a couple specific places, which I'll show you in a minute. But yeah, get tested. If you're having symptoms, you can go immediately. Now, I know this may seem counterintuitive, like, okay, if you have COVID-19 symptoms, COVID-like symptoms, shouldn't you stay at home and isolate? Well, the guidance is, if you know you have COVID, isolate. But if you're not sure, go get tested and find out. Then second, if you don't have symptoms. So what if you have been exposed? For example, in my case, a client sent me a message saying, I'm having COVID symptoms and I'm going to take a test, and a short time later the test was positive. So what if you don't have symptoms but you have been exposed? The recommendation is wait 5 full days after your first exposure before taking a test. This is to give the virus time to multiply, to populate in your body, so I guess the antigen or the viral load or whatever is easier to be detected by a test. You need to wait 5 days before taking a test. if you do not have symptoms, but you have been exposed. Okay, again, if you have symptoms, test right away. If you don't have symptoms, but you suspect an exposure, wait 5 full days before taking a test. Now, if you're in New York, you might end up here, okay? And you might click on where to get tested. Now, this is an effing rabbit hole, all right? So, like I said, if you are uninsured, you can go places like Walgreens, for example, to get tested, and you can go to any like health and hospitals center to get tested. And if you have like the $10 or $20 to buy a kit or two, you can get a rapid test from CVS or Walgreens or Duane Reade. That's what I did yesterday, and it was $16 for a 2-pack. So I tested myself and my kid. He was negative, and I was positive. But if you click this link, it's an effing rabbit hole. So no cost testing near you. This will take you to the CDC's website, all right? And just because it says search for no cost COVID-19 testing, that does not mean that's what you're gonna find. You're gonna find a bunch of for-profit test sites like Quest and CVS. All right, what comes up is Quest, CVS, and as far as I looked at this list already, as far as the eye can see, it's Quest and CVS all over the city, right? Now, Quest, they prefer to work by referral, by doctor prescription or referral, whatever that's called. And CVS, they charge for their tests unless you're uninsured. If you have Medicaid, you have to pay for the test. And if Medicaid doesn't cover the test at CVS or Walgreens, they're going to ask you to pay for it. If you are in a situation like mine where your Medicaid coverage kind of hangs you up, puts you in that weird in-between place where you can't get free testing at some of the for-profit places or at a health and hospital site, but you don't have the kind of health insurance that'll allow you to go to a primary care physician or get a referral to Quest or whatever, you can go to, if you live in New York City, in the city, you can go to nyc.gov website. If you just put in NYC COVID, that's the search terms I used, NYC COVID or COVID NYC, you'll end up here, okay? This is the New York City Government Department of Health page on COVID, and we were just at this other page we were just at is the New York State Department of Health page on COVID, all right? So for New York City, you can go to one of these. Let's see, latest vaccinations, variants, trends, total cases, vaccine data prevention, when you're sick, law. Okay, express testing. You can go to express testing. You can read the page in Espanol if you speak Spanish, and you can schedule an appointment online. So let's see, I have an appointment tomorrow at this place. I forget what DH stands for. Department of Health maybe, in Crown Heights, 1218 Prospect Place, Brooklyn, New York, 11213. Now, for some of you, Crown Heights is going to be like pretty far out there, but look, these are free tests. These are PCR tests, and I think some of them may also be bundled with influenza tests. They're doing that now, where they test for COVID, and they also test for influenza. So you can make an appointment at their I guess it's the Department of Health Center out in Crown Heights, and all you do is you click on a time that you want, and yeah, I'm not a robot. I am a robot actually, and if you don't already, as a New Yorker, if you don't already have a MyChart account, Epic MyChart, it will prompt you to log in. It'll prompt you to build an account. And you can do it that way. You can't make an appointment over the phone anymore. Unfortunately, you have to do it online. Because I did call today to try to ask questions about billing just to make sure I wasn't going to have to pay for this test, and I couldn't get anybody online. They referred me back to the website in order to make an appointment. So there you go. But at least we have the resource to get a free test, and it's a PCR test too, which is a really thorough test. It's the gold standard for the test, and usually the test results are available within 24 business hours. You can get tested Monday through Thursday, Monday, Tuesday, Wednesday, or Thursday, and you'll have your results back the next business day. So I'm going in tomorrow on a Thursday morning, first thing in the morning, and I should have my test results back Friday, sometime during Friday. If you get tested on a Friday, you'll have to wait until Monday to get your test results back. Testing includes tests for other respiratory viruses, including flu and RSV. All tests are PCR-based laboratory diagnostic tests. Awesome. Free to all New Yorkers, regardless of immigration status. How awesome is that? No matter whether you're documented, undocumented, whatever, you can get a COVID test. Okay, so that's it for the testing. Now let's go on to what to do once you know you have COVID, once you have tested positive for COVID, or if you're convinced or just, assuming that you have COVID, what do you do? Okay, so let's see. Isolation. If you click on isolation guidance, I'm at the New York State COVID-19 testing site. If you click on isolation guidance, it says find precautions to take from the CDC if you have symptoms of COVID, have been exposed or tested positive. Click on that and you go to this page. Okay, so what the CDC is doing now is they're recommending the same strategy. They're calling it the core strategy for all respiratory viruses, including COVID-19. And, they used to say, if you have symptoms, if you tested positive, you need to isolate, you need to quarantine for, 14 days, 10 days, 5 days, whatever it is. They're not saying that anymore. What they're saying is you can go back to your normal activities when, for at least 24 hours, both are true. Your symptoms are getting better overall, so you're getting better, not worse, and you have not had a fever, including and are not using fever-reducing medications. Take that in for a second. No fever, like you don't have a fever naturally, you're not like lowering your fever using Tylenol or whatever, and your symptoms are getting better. When you reach that point, 24 hours later, you can go back to your normal activities. But the recommendation is that when you go back to your normal activities, you have to be very cautious. Take added precautions over the next 5 days. 5 days after your symptoms start to improve and you are fever-free, take extra precautions. So for yourself, filter your air, open the windows, make sure that you're giving yourself fresher, cleaner air. Mind your hygiene. That means hand washing. You also have to be careful not to share towels, not to let your toothbrushes touch with your family's toothbrushes. Wear masks, especially out in public, right? Use hand sanitizer, hygiene. Use hand sanitizer when you're on the subway out in public. Masks, right? And then physical distancing whenever possible. Really hard on the subway, really hard in the grocery store, sidewalks, really difficult in a place like New York City, but, do your best. One thing I do is I wear a mask when I'm in public, even on the sidewalk, like walking my dog around outside. And sometimes people give me kind of weird looks, but, who cares? And if you're going to be around other people indoors, they recommend that you get tested, right? Especially important to protect people with factors that increase their risk of severe illness from respiratory viruses. That means people who are immune compromised, recovering from serious illnesses like cancer, people who've recently had surgery, people with a history of diabetes, high blood pressure, metabolic, stuff like that, pregnant people, the very young, the very old, people who are weak. You want to make sure that you take extra precautions around them. So keep your distance, always wear a mask around individuals like that, and mind your hygiene and filter the air, keep the air fresh. And that's about all that they're recommending right now, which is great. It's like good common sense. It's good hygiene, like good public health practices in order to take care of each other. Now, some places, for example, the FDNY, when I called them this morning and said, I'm having mild head cold symptoms, I don't have a fever, and I tested positive for COVID. Some places, if you tell them that, They can't unhear it, and they will make you stay out of the office for a mandatory 5 days. Now, this is just a case where it's the policy of the department. It might be, policy for all city workers. I don't know, but it's their policy. It's not CDC guidance. It's not the guidance of New York State Department of Health. It doesn't matter though, right? You gotta follow the policy of the place, whether it's a school or your employer or your rec center. Them's the rules, them's the breaks. Anything else I want you to know? Yes, there is. Long COVID. One of the things about COVID is that the severity of symptoms can go up and down. I'm going to do a video more polished and thorough than this one about long COVID diagnosis, treatments, and prognosis. I'm going to use guidance and information from Yale School of Medicine, the Centers for Disease Control, etc. And I think some of the things are going to surprise you as much as they did me. For example, some people who have long COVID, I don't know what percentage, maybe it's 10, maybe it's 30, maybe it's 50, some percentage of people who develop long COVID had no COVID-like symptoms. You're in Brooklyn. Some people had very, very mild symptoms and then got better, but some people also had no symptoms at first and then developed symptoms later, or had mild symptoms and then developed severe symptoms, or had severe symptoms, then it went away and then came back. It can go like that. It can come and go, appear and disappear. And there are a few factors that can be used to predict whether or not someone is predisposed to long COVID. It has to do with vascular health, metabolic health, stress level, insulin intolerance. What I focus on is why is the body not healing, and how can we use acupuncture or other self-care techniques like foods, meditation, adjusting our sleep schedule or how we sleep, breathing techniques, light therapies. How can we use these things in order to help ourselves heal more thoroughly? I hope you'll check it out by going to kimsuhealing.com, kimsuhealing.com, and just drop me a line through my newsletter there and let me know that you want to subscribe so that you'll get the notification when that video is posted. It may be for subscribers only. Subscriber-only videos or member-only videos are, there's no charge for them. They're just behind like a security wall on my site because I don't want to put everything on YouTube anymore. I mean, we're in an age now where talking about COVID is still considered to be inflammatory. So anyhow, you can tell how I feel about that. So guys, I hope that you all are doing well, and I hope you're keeping yourselves safe and, practicing good hygiene and staying up to date on all the COVID guidance. Take care of yourselves, and I look forward to seeing you soon. Bye-bye.